We have now launched the online Shockwave course. When I set the company up, which is over 12 years ago now, which is hard to believe, I was always about educating the clinicians as well, not just in terms of the technology. So when Dom Smith came to me with this idea of doing the Shockwave course, I was all for it. And Dom and Katie have done a fantastic job of putting it together. It's really impressive, really comprehensive. It is technology agnostic, so whatever system you're using will be able to help you with this. So it's a brilliant piece of work. The guys have done really well. So check it out and go to the link below and let us know what you think.
Hello and welcome. Today I am joined by Dr. Joe Larkin, who is a consultant in sport and exercise medicine at 40th Clinic and HCA, as well as a number of other roles, which we can get into. So, Joe, how are you doing?
Good, thank you. Thanks for inviting me to speak today.
Pleasure. I know we've been trying to get it in for a while. And I was doing a bit of research. I was looking at your LinkedIn as I tend to do. And I can honestly say, I think you have got the most number of roles I've ever seen in someone's history, especially for someone so young. So, like, do you actively look for diversity in what you're doing, or has that just happened?
I mean, I actually don't feel so young now. When you're in your mid 40s, I think I've probably earned some of my stripes. But certainly I have had a colourful and lots of different types of roles over the journey, and I've loved them and learned from all of them. I do like to have a role which has a challenge and kind of help make a difference within maybe the clinical setup or the process, or to have an impact on the athlete journey. And then I also think it's good for opportunities for others to then come in and spread their wings, but also to have their take on it and remodel accordingly. So I think the nice thing about sports medicine is there are lots of jobs out there. Not all of them are for life, and quite often it does mean you can come in, have a really good go at multiple different roles, and most of us have portfolio style careers. And then there's the training opportunities for others to come in as well. So I have been in a lot of different roles, yeah, but I've probably done on average a minimum of about 3 to 5 years in most. And some of them been running in parallel, whilst others have kind of built on my previous experience from, I suppose, the other sports I've worked in.
Yeah. Yeah, but it really is a portfolio career, isn't it? Because like we were talking just before about a number of different other people, and it's you see them crop up in Premier League team or at this clinic, at that clinic, and so how hard is it to manage that sort of career then? What skills do you need beyond being good at sports medicine?
I mean, I definitely would say my strength is my admin, and I'm very digitally aware. So it means that when I finish seeing a patient, all my notes are done there and then. And by the end of clinic, the majority of my tasks that are related to the patient journey's care are done and dusted, so that by the day's end, I can then flip to a different role the next day and fully engage in that. What I would say is the world of elite sport definitely isn't 9 to 5, nor does it kind of fit into a 1 day model. But by having boundaries and clear kind of working processes, you can keep on top of it. Um, the advantage of technology is that obviously you can be organized. The disadvantage means quite often your athletes in particular can contact you 24/7. And so it's having processes even on your own personal phones on how you manage your downtime as well, because that's super important. Um, but it does also mean you can quickly fire off updates and messages as they are traveling somewhere else into the world. So there's lots of benefits from embracing the world of technology. And I definitely think that's made a massive difference to my admin compared to when I was a junior doctor in the hospitals, writing handwritten notes and ticking multiple forms and chasing all the results. Whereas now everything comes into one platform, which makes it a lot easier.
Right. But how do you do that then? What is the platform? Like how does that all come together?
So generally speaking, most medical practices will have an electronic based medical record keeping system, and it just means that you can have all the records in one place, the results coming in. So therefore you're not having to kind of chase up, match up and marry up and then work out which notes go with which. It also means that for me, particularly with my clinic work, I can link the imaging and all the blood tests quite quickly. And I think even some of my athletes that are no longer technically my patients can still contact me and go, can you help me find my results for this scan? Because it's pretty easy for me to find because it's all in one place system. Each sporting arena quite often will have their own medical note keeping system as well, not only for the purposes of GDPR and medical note keeping, but also it means that you can track things like injury surveillance, illness, and actually have an impact on training loads and everything. So that integration of the different systems is really important for understanding, I suppose, the contributing factors to any injury and then how you would subsequently manage it. So I definitely feel technology has improved a lot of our knowledge and help kind of navigate not just the patient journeys management plan, but also helps us to kind of have that downtime as well and switch off accordingly.
Yeah, I mean, how do you find that? Because I certainly find it's like WhatsApp now is I'll communicate with loads of our clients, and it kind of merges, blends, blurs all of these things. Of when you can switch off, it does my fiance's head in. It like pops up with something, and you're actioning it because you feel like you do after. I feel like I've got to respond to it pretty quickly. So how do you manage that?
I mean, I don't know if I want to say this because some people might get offended, but I have, well, first and foremost, when I've had employed roles with the sports, quite often I will get a number given to me. And whilst I don't carry two phones, I'll create a business WhatsApp that goes along with my personal, and I will switch off notifications or put things into archive because for me, I'm very much an act on in the immediate setting when I read something. And so the biggest thing for me is managing when I do or don't open those messages. It's not to say I'm ignoring someone, but it's having the capacity to then act on it appropriately at the time. The last thing I want to be is one of those people that reads a message and then forgets to do the task in hand. So quite often, depending on what arena I'm in, I will archive certain messages so that they're not coming up as a notification, or I'll mute them and then at the end of the day firefight through them then. So some of my athletes might not be happy to hear that. They have been archived and muted at times. But then at the same time, I'd hope they would say the majority of the time when I do get back to them, the action is then happening pretty quickly thereafter, unless I need to follow up with someone else. So it's kind of creating your own boundaries, whether it's separate numbers on the same phone or separate phones, or whether it's muting and archiving is my biggest game changer actually for me.
Yeah. Like you mentioned before, like how things have changed from paper notes through there. How do you think it? Do you think it's changed stress levels in terms of yes, you've got the efficiency of technology, but then also you've got the accessibility of technology. So how do you think the trade-off has been for you over the time you've been doing it?
I mean, when I do talks about the role of sports medicine to medical students or, doctors that are interested in becoming into this scope of practice, it is, if you're going to work in the elite setting, it's 24/7. And that's why I kind of obviously started off with that natural, I suppose, ebbs and flows of people's careers, and some people will naturally step down from roles because there comes a point in your career where you can't give 24/7 all the time. And if anyone is like me, I want to be the best practitioner I can be for my athletes. And therefore, if I feel I can't offer that availability anymore, I think it's important to step down and let someone else who's got that energy and youthfulness about them. What I would say is, for me, there is an awareness you have to have about, I suppose, being the best version of yourself sometimes means you have to have a bit of self-care, whether that's factoring in time for your own exercise or switching off to make sure you have those boundaries. And quite often you've got to ask yourself as well, you know, does messaging right now really change it, or is it better to leave it to the morning where it's a more appropriate time frame to then action the subsequent conversations that may or may not happen? I think everyone naturally has a little bit of a self focus in their communications, whether they're elite athletes, which we know most elite athletes will say, they are selfish because they have to be driven in their goals. But a lot of us just want to get things off our chest, and therefore it's not necessarily expected by the person to then respond. And I think that was the big game changer for me. Just because someone messages me at 11 o'clock at night doesn't mean I have to respond then. I can park it till the morning when I can give it my full attention. But have all of us probably been close to overstretching our own boundaries, of course. And I think that's a given in certain circumstances, whereby when you're traveling with a team, you are fully immersed in that team setting. That means morning, noon, and night. Quite often your whole diary is full of everything, every minute planned throughout the day, and therefore even catching those few minutes to contact your family back home can be a challenge. So that's when you're not in camp, you need to really have those boundaries to make sure you prioritize those, to make sure you're not just constantly stretching. But I always say, as soon as you start to kind of, you get the email to say this is the next trip and you're not excited about going on that trip, for me that's kind of an indication to say, well, is it time now to let someone else have a go and enjoy this journey as well? Because travel is tiring. It's so fun, and it's some of the best experiences of my life with the teams have been when I've been on tour or at various competitions, but it does take a toll on you at times. And I think that's when you have to just recognize maybe you've got to shift that portfolio balance a little bit to more looking after yourself and having less impact on your well-being.
Yeah, I can imagine it's quite difficult though, because it is like if you just look at even the engagement that you get online, sport just gets everyone loves it, don't they? Like everyone
Yeah.
with football or new job here, I've moved there. It's like everyone, it's a massive thing in this country. Whatever sport it is, everyone loves it. So it gets a lot of
Mm,
attention, which means people want to be naturally with whether it's ego or whatever it is. It's like
yeah.
it's cool, isn't it? It's cool to be involved in it.
Yeah.
So how good are you at being able to actually think I'm going to get away from that feeling of wow, this is exciting to actually this is being detrimental to me, my family, and life?
Yeah. I mean, everyone has different different boundaries they use. I've always had a rule that if I'm not happy within a job consistently every single day for a set period of time, then that's enough for me to go, this isn't right for me anymore. And that's not, on and off. That's not having one day, bad day, and then everything's great the rest of the week. I'm talking back to back days where you just feel, actually, this is too much. And I think sports medicine is a very privileged role because of the fact that I do clinical work at Fortius and HCA. It allows me to always have that ability, and I think I've said this before when I've talked to people, about not a plan B, because it's not my plan B. I love that part of my work, but it gives me the security to be able to make decisions that some people can't because they're waiting until another job opportunity comes up. I don't have to have another job in elite sport before I make that decision about whether it's time for me to move on or not. And there's lots of different reasons for moving on. Sometimes it's, the kind of pressures of travel. Other times it's okay, I'm now coasting a little bit, and I think it's better to have a new challenge for myself, whether it's in a different sport or a more senior role. And I think they're all valid reasons. You just have to know what's important to you, and then I suppose reflect honestly. And I think as much as I kind of sometimes moan about the admin around our appraisals every year because we have to do so much for it as doctors. Um, Sometimes they are a good thing because they make you stop and reflect on what you've achieved, what you haven't achieved, where your gaps are, or what you want to go for next. And those conversations, if you get the right appraiser, can be really useful. Whereas when I first started doing them, I was just like, this is a tick box exercise. Whereas now I use it much more for that career discussions with someone that I trust as a peer. And so, yeah, I think it comes with a bit of seniority. It comes with parking the ego, like you say. And I don't really look at roles and think, oh, I'm missing out, because if I really wanted to do it, I'd apply and go and have an opportunity in it. So I think that journey as you get older does get a bit easier with the fear of missing out in the ego. I think at the beginning you want to go yes to this, yes to that, and you want to be involved in everything, and then you realize you're overstretched and not delivering to the best of your capabilities.
Yeah, no, it's funny. I've got loads of friends that I've known for years, and particularly football, I think is the worst for it. It's like, right, that's it. I'm not going back into football. And then literally, I'll either get a text or I'll see it on LinkedIn. And it's like, yeah, I'm just going back in for 6 months. You need me to just go in here because
Yeah,
I guess it's such a small pot in many ways, and it's a small ecosystem, and also
yeah,
it is a buzz, isn't it? Like you're doing it. So yeah, no, I think it is important to reflect on that. But yeah, for you then, so how did you get involved in sports medicine? Like, where are you from originally?
So I always knew I wanted to do sports medicine. I kind of, from a very young age, actually knew I wanted to be a doctor. And there's definitely my parents, no one in my family is medical, and they were very much like, we're not sure where this came from, but I was very adamant from a young age. My dad's an ex-professional footballer, so I used to go to the games and I used to see the doctor go on with a magic sponge and they then would get back up. So maybe there's a little bit of romanticizing there, I don't know. But certainly when I qualified as a doctor, the career in sports medicine wasn't mapped out as it is now. And I'm very fortunate to my senior peers who are the ones that work to get the training program up and running as part of the 2012 legacy application, that the times just fell into place really perfectly for me. I was already doing a distance learning MSc while being a junior doctor because I knew it was what I wanted to do. But at that point, I was planning to either go down GP, orthopedics, or A&E to then do subspeciality training in a portfolio way for sports medicine. And then as it happened, as I was getting to those application points for training posts, the sports and exercise medicine training pathway was created. And so I was really fortunate. I'd probably done it. I say fortunate, I'd worked very hard. I'd done enough to make my CV or my application, whatever it was called at that time, ST applications, I think, to get shortlisted to go to interview. But then I'm also very grateful to my colleagues that made this an easier pathway for me. So yeah, and then the rest is history, because then once you get on the training program, which is a 4-year program, the doors just start opening and you start to meet these people from senior roles who offer you experience or job roles to get, I suppose, that CV more buffered and robust so that by the time you end up being a consultant, you've got quite a bit on your CV and you've got a lot of actual practical, I suppose, experience rather than the theoretical experience to then go to interview.
Yeah. Yeah. Where did your dad play?
So he grew up in Liverpool, got signed with Everton Schoolboys and so forth, and then released to Wrexham, which nobody had heard of until recently. And now everyone's like, oh my God. And it was a professional league then. And then he moved around the country to Wrexham, Shrewsbury, Carlisle, ended up in Hereford, and then became the England and Great Britain blind football coach for the men's team. He then retired, only to now just come back to help develop the women's blind football team as well. So he's just actually traveling back from Germany as we speak with the women's team from their first ever competition. So that's a huge,
Oh, wow.
yeah, super proud of him.
Right. Yeah, that's amazing. Yeah.
Yeah.
So now I can imagine that was he's played for quite a few Northwest, bottom
Well, he's from
Northwest.
Liverpool as well. So is my
Yeah.
mum. So
Who does he support?
he's Everton.
I'm an Everton fan. That's good. I like the sound of that.
It's a
Um,
hard team to support. It's not a hard team, but it's definitely a
no,
lot
it
more
is. No, it is. It is.
traumatic towards the end of the season compared to maybe Liverpool.
No, well, we had Danny Donachie, and I don't know if you know Danny. He was head of
Yeah,
medicine at Everton for years, so he's been in today in the office. So I always like hearing some of the tales from inside. But I'm
yeah.
sure, I'm sure you've got plenty as well in that sporting world. So then, for you then, so when you were, where did you go to medical school, and like, what were the aspirations? Was it from like your dad doing that that you thought actually, even though maybe it wasn't even, I guess it was before 2012 this point. So it's like, well,
Oh yeah,
what?
yeah. The training program was part of the bid to win 2012 to come to London. So the training scheme was established prior to 2012. So I really love. I mean, I always, as I say, I don't know where it came from, but I wanted to do medicine. I was fascinated by the human body, and then I think for me, particularly the physiology and the ability of what you can do on a performance level always just intrigued me, and how capable the body is to adapting to various, stimulus, both recovering from illness all the way up to high performance. And I just found that really interesting. And so I suppose for me, there is the excitement of the trauma in a pre-hospital setting, I'm not going to lie, and certainly certain sports lend to that more, i.e. rugby. I don't remember a game that I've covered that I haven't been on the pitch for some sort of injury, whether it's as minor as a finger all the way to head injury, suspected neck injury, and so forth. So I think you get that nice mix in sports medicine, that you are working with anatomy, you're working with physiology, you're working with developing performance, but you're also getting the pre-hospital trauma and so forth. And so I think even when I was looking at different ways to get to sports medicine, my interests were always in those, I suppose, specialities that had that element to it. I think, the great thing about medicine is it's a huge umbrella of different subspecialities. And one of my really good friends, dual accredited in law and is now a forensic kind of pathologist. I've got a friend that's doing plastics, vascular, you name it, and we all trained up together, but our journeys kind of went slightly differently as we aged, I suppose, and that's the great thing. But I just stuck to what I liked, and I knew that was what I wanted to do. So I just kept stacking up the kind of experience to help lend towards sports medicine.
So what was your first role then once you'd graduated and you'd gone through that?
So when I was I was very fortunate actually that a lot of the um sports had very open door policies to talk to people and give them guidance. So my couple of my first roles were with the England FA, with the women's football team. And actually it's really nice. One of the ex-players has actually come back to shadow me to become qualified just recently as a doctor. So that it's really nice, those interactions you have. And so I worked it for the England FA in the women's age group categories, and then that's when I then moved over to, after that, I kind of moved towards rugby, worked with London Scottish. London Scottish then led to me working with the women's senior team on a tour because their doctor couldn't make that trip. And then that then meant that I went with the men's age group. Then I went, so it's that pathway where you kind of, one job leads to another and you get these opportunities to go on one trip, and those one trips then convert into another job. But during my training, we got so many opportunities. I mean, I worked at the British University Games all the way to the Olympics. I worked at Headley Court in the rehabilitation setting, which was unbelievably inspiring, but also so supported from a consultant kind of development point of view. And some of my colleagues there were definitely the reason why I was able to push forward and become, successful in other domains. Um, and then you learn about sports you don't want to do. Like, I've done trips where it was great to have that experience, but it's just not for me. And I think that's really important as well, to acknowledge that not every time you go to a role is it going to be the one you want to do. And that's great because it means it's suitable for someone else. So football, but I left because for me, I grew up with football and I loved it. And this is going to sound quite weird, but it didn't really have as much nitty gritty for me from an injury point of view. In the way of football works, it's very much the physio goes on, you have to be invited. The doctor kind of is there kind of to do stuff, definitely, and is part of the team. But for me, I loved what rugby was able to offer, which is you do feel like you're part of the game. You're on and off the field of play without needing permission. You're making decisions and radioing up to the coach. I felt like it was much more like I got a buzz beforehand, like the players get kind of a bit of an adrenaline kick pre-match. I would definitely feel that kick in um, for a rugby game. And then I loved tennis when I moved to there. That was a very different lens. That was less trauma, but a lot more supporting behind the scenes in the individual's development and so forth. Well, not
Yeah.
development, but rehab management. They look after their own development.
Well, yeah, definitely want to touch on the tennis. And I'm just going back to the time. So when I was caught up with Tim Swan recently, and he was raving about you. He didn't particularly go into anything, but like why would he be so like? He was really, really positive about you.
Oh, I mean, I can't tell you how special Headley Court was for me, and if it hadn't moved to Loughborough, I probably would still be there now. It was such a special environment of like-minded people, challenging the norm, able to feel comfortable around asking questions. And I think the way the military is set up, from not being from a military background, I think I had probably some conceptions around, oh, colonels will be this way, and actually they were some of the most approachable and supportive people to help facilitate your own development. And I think no question was stupid, which we all say, but actually in practice that was the case. And I think for me, Tim was one of those colleagues that I just got on really well with, and we had our separate area where we had our offices, and on Friday we'd all probably wrap up with trying to finish all our admin and then have a little chit chat about what people were doing for the weekend. And you got to know people on a human level because of the way lunchtime was and how they encouraged exercise. I mean, it was just brilliant. And I think for me, beauty about working for the military was when you left work, you really did leave work, because you weren't allowed to have any technology that was accessible outside of that arena. So actually on a Friday when I left Headley Court, I wouldn't be thinking about work until Monday unless I was on call. So yeah, I think it was brilliant. And Tim, along with so many other of my colleagues, were just amazing people, but also very, very key to my development as feeling comfortable, particularly as a female. I could have gone into those environments where it was predominantly male and not felt like I could speak up or challenge a conversation or think about a new idea around how I wanted to help change the course in a certain way, because we'd have these admissions for 2 to 3 weeks, and I was able to influence how we would run those courses for the injured servicemen and women. And the colonels, well, the lieutenant colonel and the colonels, and it was multi services actually, so there was RAF there as well as Navy. They were all unbelievably open to having conversations and letting me feel as a civilian that I could have an opinion, but also help develop the service. And I've got a lot of, yeah, I'm very grateful to them.
Yeah, no, it's great to hear about environments like that where it's challenging, but it's still warm. It's trying to get that balance of that leadership. Like, do you feel like there's many of those environments out there?
I think everyone's aspiring to have those environments, particularly in the elite setting, because you are traveling as a unit or a family or a cohort, whatever terminology you want to be, and you want to be able to create environments where everyone can thrive and perform, whatever that. It's not just you want to help the athletes be the best versions of themselves, but you want to help your practitioners or your coaches or whoever also to become the best version of themselves as well. I think culturally, the key head roles will always influence how that is. And I've certainly been in some environments where it is unbelievably a high performance level, and everyone is ticking at the same level, and they're happy to cross and challenge, but then know it's to be bringing the best out of each other. And then I've been in other environments where unfortunately sometimes it is a bit of fear and people don't feel comfortable, or if you are someone that speaks up, you're seen as, you know, challenging or direct or aggressive or whatever that terminology is you want to be. And I've definitely got some examples where I feel that everything was perfect, from the timing, the level of practitioner and the players and the coaching staff. And I've got other times where I've witnessed probably unhealthy relationships, which then don't lend to then having a great experience or a great outcome if you're looking at it from an objective performance marker.
Yeah. Well, where were the good places then? Where were the ones that really stand out for you that was just like, this is just exactly right?
I mean, so there are so many examples, to be honest. So the first trip I went away with the women's rugby, unbelievably welcoming. The players all made me feel part of the team. The coaching staff were great, and that cohort went on to win, a World Cup, and some of the players are the most capped players currently for the RFU. So for me, those players and the coaching staff created a culture of development. The set GB7s to the Olympics was an unbelievable experience for so many reasons. One, we'd never had a GB7s team before. We were going off to Rio. The journey to it was really intense, but the goal of medalling for both the men and women were realistic goals, and the men got a silver. Unfortunately, the women didn't medal, but still had a great tournament overall. And that was so exciting because we were bringing the different home nations together for the first time. Which obviously comes with challenges as well, but also a great kind of we're all in it together. And the men's and women's journey were very different. So the women had pretty much the setup for the year leading up into Rio, whereas the men's had about 10 weeks before we got out there. And actually, the teams weren't even able to play. We didn't have our team play officially together until the first match in Rio, just to do with the regulations on the European circuit. We weren't allowed to swap teams once they were named. And so our final cohort that went to Rio, the first match they ever played together was the first opening game for them. So that was really exciting. But the colleagues that I was working with at the time were unbelievably talented. We were definitely able to have discussions that were very open around reflective practice of what we could be doing better, and not seeing it as a negative thing, but seeing it as a positive. And then the tennis environment, when I've went on the Davis Cup and the Fed Cup, which is now the Billie Jean King Cup, they are unbelievably phenomenal experiences and such unique experiences, because tennis is generally an individual sport. So suddenly to create a team sport in an individual environment and see how the dynamics work, and get to play cornhole, which is now my new favorite game, and I've even bought one for my, well, got given one for my birthday. Cornhole, it's basically two boards with a hole in, and it's a beanbag game where you throw it, and yeah, I mean, Google it, it's great. And you know, I loved it, maybe a bit competitive with it. And yeah, but then even with the sailing, like I didn't have any sailing experience, and got approached to apply for the role. And I mean, I absolutely, sorry, I'm just going to shut that off. I think something popped up on my noise there. Apologies for that. Yeah, I can't get over it. I mean, the environment was so unique. A, being on water, B, not being a sailor, and just seeing how all the different teams worked together, and it was a big traveling unit. I mean, it was great. It came with its challenges because there was so much travel, so much setting up of restarting every month at a different venue, but with that came a lot of travel experience and a lot of international knowledge. So there's a lot of very good experiences, including the Headley.
Yeah, before we go on to the tennis then, because I'm definitely interested in that. Well, so that's sailing then. So what actually were you doing? What was the competition?
So the company I was working for was called Sail GP, or it's still around now, it is called Sail GP, and my role was Global Medical Director. It was essentially a startup, give or take, when I got there, or at least in that startup phase. And essentially it was high speed racing. And when we say high speed, we're talking, you know, some of the teams have hit their 100 kilometers per hour on a race course, with various teams from different countries competing together. When I started, it was 8 countries. I think it's now up to 12. I think Brazil's about to have its first ever female driver slash skipper, is the old terminology. And what we would do is, it was kind of referenced as the Formula One on water. So a bit like the Formula One setting, in the sense that the race would travel around the world internationally. And I was overseeing the medical governance, delivery of medical care on the kind of the site when the competition was on, and helping support the training for our safety teams on water, all the way to then helping support the operations with getting first aid for the tech site, helping make sure we meet the standards for the appropriate medical support for the crowd. So it was a very diverse role. And with it was quite a big learning curve, because traveling as a national team internationally is very different to being an international event, where you've got so many different well, there's loads of legislation that varies from country to country, practicing requirements, applications for medical practitioners to be able to do what they need to do, but also the fact that some countries don't have water events, so upskilling the local team to make sure by the time the first race is happening, we're safe and appropriate in our medical support for the athletes to go ahead, to perform at their best ability. So Dubai is a good example where I turned up. I was told that the paramedics we were going to have on water were experienced paramedics, but neither two or three of them couldn't even know how to get on and off a boat, let alone one of them couldn't swim. So there was a lot of upskilling in that week to make sure that we had the right medical provision. But we always travelled with a core global team to help that education and training process as well.
Yeah, no, it's fascinating. It really is. You don't even think about a lot of these things. Like, how do you get these jobs? Like, how did you get that one?
So I did go through an application process, but I would say the big thing for me is sports medicine is a small world, as you alluded to, and I've always tried my best to work collaboratively with everyone, even outside of my functional area. And so I think kind of with the tennis role, I kind of got that through a colleague that I knew in the rugby setting. I never directly worked with him, but he happened to be head of performance at the time at the LTA, and the doctor role had become open. And so he started talking to me about would I consider the role as chief medical officer, and had quite a few conversations. And yeah, my head was turned. I love tennis and I wanted to do it. And similarly, someone that had been at the LTA had then gone over to Sale GP and kind of given me the nod that this job's coming up. Would you be interested, or would you be able to help signpost people to the role? And I think, again, just because of the way I reflect on where I was within the tennis world, this was a promotion from a CMO to a global medical director. It was completely new. And I think I was ready for that challenge. So it came at the right time. And I suppose the people that I'd worked with in different kind of divisions, or whatever you want to call them, functional areas, had a good interaction with me and so put me forward. And I think that's the way that's the way it goes sometimes. It's about treating people nicely on the way up and down, and also being hopefully seen to be a hard worker and good at your job. And I think that's probably where it's come from, and I've always tried to give as best as I can in a job. But yeah, so it was kind of
Yeah,
a bit of a, I still
and
had to
I
apply and
agree.
go through.
I
Yeah,
think it's like it doesn't need to be that complicated for a lot of this stuff, is it? If you're just kind of decent person, you just do what you say you're going to do,
yeah,
communicate, and then hopefully you got the other skills. But that is sometimes it is secondary, isn't it? Because if it's like
yeah,
I'm not giving them the job,
no,
do
yeah.
your head in. So like, what did you actually do then? So what were you based at Roehampton, or where were you based for it?
Oh, for the tennis, yeah. So I was based at the National Tennis Centre in Roehampton. I think my role started off as 1 or 2 days a week, actually, but by the end it was a full-time job. And I was the sports medicine physician to help support the physios that were working there and the strength and conditioners and so forth. When we would work together as a multidisciplinary team to help support the tennis players to get back from injury, or we would do screening, or we do optimization of performance. And so for me, there was definitely a sports medicine role from a clinical setting, but then I also had the chief medical officer role from a clinical governance point of view. And so part of my role was coming in, making sure we were meeting the national and international standards on various elements, as well as also benchmarking against a thing called CQC for our kind of clinical environment. And then COVID happened, and I would say my job definitely pushed more towards the clinical governance at that point, because clearly it was a time of, yeah, a lot of hard work. And I was actually very fortunate and very grateful to be invited to be part of the CMO steering group for DCMS, the government who was helping us to create a return to sport pathway. And I think that was as much as COVID was obviously horrible period of time for so many people, the good things that came out of it for me was the collaborative working with other CMOs and sharing of ideas and helping support each other in case management scenarios and or return to sport. And so for me, I'm very I like to try and see the best in everything, and I'm really grateful for that experience. And so during that period of time, I'd say for a lot of us who were CMOs, our clinical hands-on period probably reduced a little bit because we were doing so much on the documentation and the protocols to make sure we could get the athletes back safely, to be able to play and then go on to compete internationally.
It was interesting. Yeah, I caught up with James Cole and did one of these with him recently because I know he was involved in some of that as well.
Yeah.
And just let's go back to the tennis then. So like you what like how but you're a fan. So what is it like for you when you're going in and you're working with Andy Murray or whoever it is? And I love Andy Murray. As I think he's one of the best athlete we've ever had, arguably. He's so impressive.
Yeah. I mean, I would say what you realize when you're in sport is everyone's just a human being. And I think it's really important to treat them not like they're a famous person. And whilst I appreciate, we've all probably got our own person that may be a bit kind of, oh my God, I'm working with this person. The reality is once you get over that, you've got to just treat treat everyone the same. And I have to say, Andy was amazing to work with and a great human being and great sense of humor and probably one of the most well-read athletes for challenging me on, well, why would we do this? And I've read this and I think we should consider this, that, and the other. And it was great. But all of them had their kind of, I suppose, unique features and some of the, I just would say you just have to not be phased and you have to treat them like they're just the next person along in the clinic. And it's not to say you shouldn't be aware of how amazing and talented they are, because that's part of your plan around goal setting for return to performance. But ultimately, I think if I kind of was fangirling every time I went in, I don't think they would trust me. And also I've got to be able to deliver sometimes information that they don't want to hear. And so for me, it's about building that relationship of trust. And giving them the awareness that I'm comfortable to work in the grey when the goal is around the corner and it's maybe a Wimbledon final or Olympic gold medal or whatever it is. Like each person's goal on their performance journey will be different, and you've got to know when to push and when to pull back to think about the bigger picture. And that just comes with building a relationship, asking the right questions to understand the individual's goals and needs. And that's true of any patient. Like you want to be patient centered, you want to have them making an informed decision and supporting them in that decision. But equally, if they need the support of a bit of extra information, you give it and you go and learn about it if you don't know about it already.
Yeah, and so how does the dynamic work then? So because tennis is an interesting one compared to the team sports where they've got their own team. So whether it's Mark Bender or whoever it may be that the player is working with, what is your role within that dynamic?
Yes, it's really interesting. So I think when you're employed by a team, the team inherit you as the doctor, whether they like it or not, and you are the doctor. With tennis, I think for me, I had to build those relationships, like I just said, individually, one at a time. It wasn't a given that the athlete may come and see me, because even though the LTA employed me and I was available, they might not want to. And because they are their own CEO and they pick their own teams, they can choose by voting with their feet. But by the end of the journey, you know, I had the support and worked with the players from both the men's and women's senior team all the way down to the juniors. And I think that's partly because I made the effort to get to know what they needed. I also was available for them when they needed support, whether they were in Timbuktu or in London. You have to be able to provide guidance. And so for me, quite often they don't inherit you, they have the opportunity to work with you, and it's those first couple of interactions and consultations that are really key to go, well, I want you to be part of my team. And they don't have to do that. They don't, it's not an absolute rule. And so for me, it was a real privilege and an honor that the players did choose to work with me, and quite a lot of them still are in contact with me now, just either as sound checking or come and see me in clinic, or just a conversation to check in with how I'm doing. And I think that's that's because it's a two-way thing.
Yeah, like for you then, have you ever experienced imposter syndrome, or just like, how have I ended up here? Like, who am I to be doing this, or anything like that?
I mean, I think I always stop and make sure I feel I'm in the moment and I'm grateful and I can see where I've got to. I've been very fortunate that, my mum and my dad and my sister are such supportive people that from a young age, as I said to you, I wanted to be a doctor and they did nothing but support me in that journey. And if I hadn't been a doctor, they wouldn't have minded it. They just want me to be happy. And then the colleagues that I've had some amazing advocates for me that have made me feel supported and present and appropriate to be at the level I was at. So I've had external people validating where I've been, and I'm hoping I'm trying to do that for other people now as well when they, meet with me to do the same, because I think it's really important to know that you should be there and you do have a voice. But I think I'm just very fortunate that that has come from a very young age from my family and then similarly from my colleagues. I've had those pinch me moments, but I also believe, like, why not me? Like, I just don't think we should, I work hard, and so yeah, why not me? Why them and not me, kind of thing. And now I'm kind of comfortable with where I am. I think there's times where I think, oh God, like particularly with the sale GP role, it was a huge step up. But I thought, actually, I've got the skill set, but I kept getting told by my line manager, who was brilliant, like Rome wasn't built in a day. And that was a great thing for me to feel like I had time to develop what I needed to develop. And there's still so much to do when I left and moved on, that the person that took over from me probably thought, God, what's she done? But there was nothing when I came in. And so for me, it's just making sure you don't get overwhelmed and actually think to yourself, actually, yeah, you're right. If there's nothing here for me to build on, I've got to start and then someone else can build on it, and just having the right people around you to reinforce that message.
Yeah, no, I love the expression "why not you?" because literally someone has got to do it, and and then even if it's something doesn't exist, why can't it be done? So
Yeah.
that's definitely a good philosophy. It's I think, yeah, I think it's a really important message. And like, how important is it for you? Like, from you've obviously got the clinical skills, but then for you to maintain those relationships and for them to trust you and want to come to you, what proportion of that is just because they feel comfortable with you or they trust you beyond the clinical side of things and they like you even?
I mean, I suppose that's true of any human interaction, isn't it? You make your decisions quite early about someone, but I think for me, the proof was in the pudding. Like if I said I would look into something, I would. If I would get the information or do the referral or whatever the admin or clinical task was, I delivered. And I think I wasn't someone that just said, oh, yeah, yeah, I'll get on with it. I would go off and find it. And I was also someone that was very, or still am, if I don't have the answer, I will go and find out for you. I'm not going to pretend and like make it up and say, well, yeah, I'll go, yeah, you know what, this is above, beyond my remit, or at this moment in time, I don't know, but let me go off and find out and I'll get back to you. And I think, it's an important thing to realize we can't be amazing everything, and we need to work with collaboratively with other people, and knowing your limitations is just as important as knowing what you can deliver. I think the uniqueness with the tennis was I wasn't employed by the player. The LTA employed me, which meant that I could probably have discussions without fear of losing my job. And I'm not saying people who are employed by the tennis players are scared and can't, but I just know that I could be really honest and go, this I do or don't think is in your best interest. And if the athlete doesn't want to take my advice, that's fine, but I will try my best to explain my reasoning. And I've always said as well, like, if you want to try and prove me wrong, by all means do. I would love them to get back quicker and without any reaction or recurrent injury. But I also have to tell them my experience. And if it's not to say my experience is perfect, but I have seen these injuries and seen how they're managed and how important it is to have those real clear building blocks and foundation to be able to get back on the court, the pitch, or whatever. Um, And so I think it just comes back with talking their language. If I talk just medically, like, oh, by the way, you've got, I don't know, MTSS, they'll be like, what? Whereas if I say, you've overtrained and overloaded this part of the tissue and it's multifactorial, and let's go through the checklist of what these things are, and we want to get you back to be able to perform, go deep into a tournament. We want you to be able to move on the court, to be able to get the shots and so forth. You start using the language of whether it's the player, the coach. That's great. And I think that's a huge skill set that a lot of sports medics, both physios, doctors, S&C, we all need to do, because ultimately it's a language that people understand and it's joined up. So yeah, I think that helps as well, saying, look, I understand, or if I don't understand, tell me what I need to understand about this so that I can plan accordingly and give the best advice.
Yeah. Yeah. No, I think that authenticity and being clear with what you're doing and speaking their language, that definitely resonates. And then so I could talk about the tennis all the time, but like, tell me actually, what was your best tennis memory?
Oh my gosh, I got so
You've got
many.
to pick one.
It's probably the cornhole tournaments. I mean, I loved being, I mean, the Davis Cup in Madrid when GB played Spain, and Rafa Nadal's on there and our team is stepping up and like really performing well. That was such an experience, that journey, because it was quite an intense competition to get to that kind of, unfortunately GB didn't go on to win, but the level of competition was amazing. But yeah, I mean, there's just so many. I mean, I love tennis. I love watching it. I love the demands of tennis, and the challenges for the athletes are second to none. I don't get me wrong, I understand the physicality of so many sports, and I would say rugby's, full of injuries and complexities around that, but psychologically and the travel components of tennis are just unbelievably challenging, and they have to be this robust power athlete but can still do endurance for up to 5 hours, get over losing a point and then get back on and try and win the game. It's such a great sport. So I say this like, but then the first time I was working at Wimbledon, I mean, wow, like walking into Wimbledon and being behind the scenes and going in the warm-up area and seeing all these elite athletes. And when you say seeing them all, I mean like seeing them in their unrestricted, environment. It was just amazing. So yeah, I think the memories of the team element will be the bonding that you do when you play the games behind the scene, and that's when you build those memories. But the games themselves or the matches themselves, I mean, I could list so many.
Yeah. Yeah, no, particularly again, talking about Andy Murray, but like just what he'd done at the achievements over the years, and then
Mm,
hopefully Draper's going to go on and take over the mantle on that now.
yeah.
And then, so how did you get involved with Fortius?
So a couple of ways, but ultimately I was already referring to them for the orthopedic services when I was with England Rugby. And so I'd got to know the likes of James Claude, as you mentioned, the Andy Williamses of this world, and they were always so approachable, collaborative, and would go above and beyond to like pick up the phone to make sure I was informed in what was discussed or what their feelings were. So that made it feel more cohesive in a management element. And then myself and a couple of colleagues were working elsewhere, and there was a reason we got approached to move over, and we did, and the rest is history basically. And the way Fortius, I suppose, was set up, it's not so much the set case now, but when we first joined, it was very much through recommendation, and then they would discuss it at a group level in the subgroups, i.e., the foot and ankle, the knee, the spine, and so forth. And then if they approved you, they would come along and have an interview with the CEO at the time, and then you'd make the decision then. So that just happened to be one of those conversations. And then I went to meet the CEO at the time, and the next thing is I'm working there. So yeah, it was great.
Yeah, it just seems like such a success story, and like seeing the growth and being acquired and then everything. It's good, and like James is still so down to earth, and like passionate about it. It's really
Yeah.
nice to see. It's just nice to see that, isn't it, from something that's done really well.
I mean, yeah, the original cohort definitely put a lot of work in and graft to get it to where it is. And I'm just fortunate enough to have been on that journey after they'd done a lot of the hard work. And well, we're still growing now, so it's getting bigger and bigger.
Yeah, I mean, where do you see the future of the MSK industry, which is a very big question. But like from my side, it's really changed a lot, not just because of COVID, but just from NHS and everything like that. But
Yeah.
where do you see it going?
I mean, gosh, that's a huge question because obviously the NHS and currently is just unbelievably overstretched. And as I say, I'm super proud we have an NHS and I'm grateful for the times I work there. I think for me, I would love to see more kind of proactive rather than reactive management. And I personally believe that starts with exercise and education around nutrition and all those elements. And so for me, whilst I am elite sport for quite a few of my roles, I do believe the exercise medicine component of my title is unbelievably important for um, understanding physical activity, understanding how we promote it for well-being and not just well-being for like how your body functions, but mental health, all of those elements. Um, I think the reality is it is changing, as you say. So, and for some people, COVID was definitely a positive thing on their physical activity levels. And for others, unfortunately, it was a deterioration. I think we've got a lot to do to kind of promote the importance of physical activity, promote the fact that we should be trying to be less sedentary from a day-to-day basis. And I think we have a responsibility as the people being trained in sports and exercise medicine to work collaboratively with other specialists to kind of make sure they're aware of it. And I think that's why I'm proud of Fortis, because I think, we collaboratively work. And if I look at my list yesterday, there were several of my colleagues who are orthopedic surgeons going, this isn't surgical, but I know you need a review to make sure that you get over your injury, but understand the why to prevent it becoming back. Because everyone understands that to remain physically active is beneficial for your long-term health, and minimizing the risk of, chronic diseases and metabolic diseases. So where do I see it going? I think that's a big, big question that's very politically going to be led. I wish the NHS wasn't a political playing card. I wish we could start planning in 10-year cycles, not four, which then become three because they need data, and start looking at long-term planning to be able to support things in a more strategic manner. Because I think if you were to look at the elite business setting, most people wouldn't, they would do some short-term goals, but most of the strategies would be over a block of time that is sufficient enough to see real change and reform. I think if we could do that, and I'm sure people would say that's true of education, that's true of all these things, but if we could do that, I think we could potentially have a better outcome for the NHS to be able to help deliver more proactive rather than reactive services, and not waiting for the person to be in so much pain that they need a knee replacement because they then be told that they're overweight, but actually when they first started the journey with their knee injury they were healthy, appropriate, weight for an operation with no comorbidities, and by the time they actually get the operation offered to them, they've deteriorated massively. I would love to be doing more at that early stage.
Yeah. Yeah, no, I think it is massive, but I definitely agree with you. I think it's so difficult because there's some amazing stuff. Like John Rogers was, seeing me on the NHS not long ago, and
Yeah.
it's amazing to have that, and people don't always value it. But then it's yeah, trying to get that across the board, and like just finishing off here as well as like you talk about mentoring and how important that is to you to pass that on. So, what is your advice that you would say to people that are trying to get into the industry or are already in it, and just in general, what would your advice be?
I mean, from specifically from being a doctor in sports medicine, a lot of the universities now are creating societies that are sports medicine specific. And quite often, myself and others similar to me are invited to do talks to explain our journey and how you go about getting into sports medicine. I think for me, it is there is still quite a small number of training posts relative to other specialities. So I think you have to be very dedicated and, going above and beyond. And getting work experience where possible, and reaching out and knowing that you're probably going to get a lot of rejections of saying, no, sorry, we can't have you in clinic. But it only takes one person to then open that door, and then you get more and more. So I'd say you have to be probably relentless in some of the pursuit to get the opportunity. But I do think as the speciality becomes more and more established, which it is, the pathways will be more clear. I just think you have to be open to be going a bit above and beyond what is put in front of you. And I think that's if you look at, let's just say cardiology has been around for so long that you know what to do, what exams to take, and it's very kind of, the pathway is pretty mapped out. There will always be people that do things differently, which is great. I think with sports medicine, there's a lot of this still and less of that. And I think the people that are coming through need to be aware of that, to know that they still have to kind of go above and beyond the requirements of what would be normally deemed a tick box to get the application in.
Yeah. Yeah. No, I agree with that as well. And like just we were saying about the environment, it's creating that environment where people want to do that, and like actually they feel like they're trying to create what you are at the military in the grand scheme,
Yeah.
the wider scheme is great. It's obviously it's not always easy if you're not in the same department.
I think
Uh,
also, though, it's down to us as well. So, for example, my current role is tournament medical director for the Rugby World Cup next year, the Women's Rugby World Cup 2025. And part of that role, I could easily just go, right, I'm going to deliver medical services for the events with field of play management and onward directories of services, tick, tick, tick. But what I'm trying to do is a bit of a legacy piece. So we're creating, you know, opportunities in the volunteer domain with medical and anti-doping. We're creating a sports medicine training opportunity. We're going to be doing some public health. So I also think it's still on us to be thinking laterally and creating opportunities for people. And I hope, through those opportunities, people get interested, and then the ball starts rolling.
yeah. No, it's exciting. That is really exciting. There's loads of stuff I could ask you, but last question.
Yeah.
What do you read books outside of medicine, like self-development, professional development?
I read books. I tend to read novels or fiction just because I like to switch off. Although the last book I read was pretty heavy going. It's called A Little Life. Um, but yeah, I probably read for pleasure. I read novels and things like that. Of course, I stay up to date on journals and evidence-based medicine and practice, and I go to conferences. But that's how I probably keep most of um, my skills up to date through that forum. And certainly I've just come back from a conference last week at the International Dance Conference. I'm off to go and speak at the Major League Baseball conference in a couple of weeks' time. So I do try and keep up to date through going to conferences, reading in preparation, and also if something crops up that I think, oh, that's novel, I need to read around it. Or, for example, like I said, if a patient asks me about something, I'll say, I don't know about it, but I'll go and look into it for you. But from a point of view of what I read normally, it would definitely be fiction.
What's the best fictional book? Not as heavy as A Little Life.
I mean, oh God, I can't, but I loved Harry Potter. Like when I was
Harry,
doing
yeah,
when I did my neuroscience degree, I mean, neuroscience was pretty heavy hitting, and so my roommates at the time were reading Harry Potter and talking about Gryffindor and Slytherin, and I was like, "What are you talking about?" It sounded like a new language. And then in the end, we went on holiday, and by the end of that holiday, I'd read the first three books. That's how far behind I was on the curve. Three books were already published, and I loved it. And I'm actually now rereading them. Or I say I'm not reading them, my partner's daughter's reading them of an evening, and yeah, I'm loving the journey again on Harry Potter.
yeah. No, they are good. I need to go and see that Cursed Child actually. But yeah, no,
I've
there's.
seen it.
Is it good?
Yeah, it's two whole day. It's two
It's
over
two
two.
parts, isn't it, in a
Yeah,
day? It's a bit of an interesting thing. Yeah, I mean,
yeah,
we're in London for a semi-work trip for Christmas time, basically.
yeah.
So we need to get it booked in. I think. Is it worth it, or is a different show better?
I know. I mean, oh God, I love going to theatre as well. But yeah, I that was great. I mean, I love Hamilton, Book of Mormon, all of those ones. But I definitely enjoyed the Harry Potter Cursed Child for sure.
Yeah. All right. I'll let you know if we get onto it. Joe, thank you so much for sharing.
Not at
Really
all.
fascinating. Really appreciate it. And yes, I will look forward to seeing you soon.
Take care. Have a lovely weekend.